For this assignment, I interviewed Jenny Fitzgerald, who is a trauma clinician. She has a master's in community counseling and an licensed professional counseling degree. Our interview is about 25 minutes long. She has her own website. She specializes in teen and children and women at any level. The first question that we went over was, how long have you been practicing as a trauma therapist, clinician, and what drew you to the field of trauma work? She has been practicing for about 13 years now. She started in 2011. She did say that she took a break for about 4 years because of burnout, but she continued to mentor people and work with people in her life, so she didn't really consider those 4 years as taking a break from the field. She said for what drew her to the field was the trauma that she had experienced as a child, and she wanted to learn how to break cycles of generational trauma. And as she learned to do those things, she wanted to help other people in those regards as well. So her main passion is to break generational trauma and to work with people and learning how to do that themselves. The second question was, what do you find the most rewarding and what do you find the most challenging about this field and practice? She said the most rewarding part was to sit in the trenches with people. She thinks it's a very beautiful and powerful thing to be able to sit with people in the darkest parts of their life. And she says the most challenging part is the personal secondary trauma that she has to deal with, and learning to compartmentalize the different things that she's seeing within her clients and what she's experienced personally. The third question is, share an example with me, a case that represents the clients that you've worked with, and be sure to ask follow-up questions concerning primary symptoms, diagnosis, lengths of treatment, and modalities used. She did not give a specific case study, but she did explain that she works with mostly females who struggle with anxiety because of their trauma. Specifically, about 90% of those cases are probably sexual abuse, and then child abuse as well. Those are the main focuses she has. She has worked in a couple different areas. She worked for a Christian mission when she first started. It was mostly low-functioning people with emotional trauma and addiction. She talked about how the poverty levels within that area made the practice a lot more challenging, and because of the poverty, insurance was a big issue, and so if they were able to be insured, they would only get 6 to 10 sessions. And people could be seen for years because of the trauma they have, but because of insurance, they would only get 6 to 10 sessions. She did switch to a nonprofit practice after that. Right now, she has her own practice, and she works with high-functioning people but have strong trauma. She thinks that the high-functioning versus low-functioning is generally because of poverty in the areas they have come from. So the strong, high-functioning people she's working with right now have come from a higher income class, so they have more support, so they can function better and interact better, but there's still a lot of trauma and things going on inside that they don't necessarily disclose to other people. She says that she uses a lot of CBT, talk therapy, visualization, narrative therapy, and toolbox building. She thinks that toolbox building is very important to her practice, specifically building on education about trauma and the tools that her clients can use to continue to grow as a person. Yes, specifically within young women who are struggling. That's generally who she works with. So helping them build those toolboxes helps them be successful in the future. Then question number 4 was, what treatment practices or interventions have you found to be the most effective when working with clients who have been impacted by trauma, and why? She talked about CBT exercises, visualizations, and narrative writing. She talked about how she really, really loves to give homework, specifically like journaling and different ways that they can use what they're learning within counseling as application. She talked about that a lot. It was very important to her that she can see they can take something home to work on and see different ways to make progress while they're at home. And journaling, she says, helps with a lot of people, but not everyone likes to journal, so she offers alternatives to that as well. Number 5, burnout and secondary trauma is high among clinicians and providers who routinely work with traumatized populations. How do you, if any, take care of yourself and help protect against burnout, secondary trauma, and compassion fatigue? She really, really loves to teach about this. She says, as soon as I started to ask the question, she said this is one of her favorite things to talk about and teach about. And she says learning to compartmentalize is very important. And she talked a little bit about how she knows which types of trauma she can handle. So like, she may be able to handle like one sexual abuse case and one like substance abuse case, while she can handle like 5 child abuse cases. So like learning how to compartmentalize and figure out which cases you can handle, and then communicating that with your supervision if you have that, so that they can give you the best caseload possible, so you have the most likelihood to be successful. And she talked about how she has a network, and how it's really important to have a solid list of people to refer people to when you have to say no. She says that she is faced a lot with telling clients that she can't take a new client in. But because she has a solid list of people to send people to, she doesn't necessarily feel the pressure of saying no as much. She says for her personally, her faith is a big portion of how she takes care of herself. She says there's a balance between dark and light, and she tries to do that within her own life. She sees a lot of darkness within her counseling, but so she tries to balance that out with like things of light within her home. So maybe that's spending time with her family, or spending time for herself that will allow light into her life. And yeah, so faith is a big part of that as well, because she can bring in what she's called to personally, and she feels that she has been given the ability, but she is not responsible for these people in their lives, but she gets the opportunity to help them and invest into their lives. And she says also counseling herself, getting counseling for herself is also very important. It's anyone who's counseling should be with a counselor. Pretty much everyone should be with a counselor, but that's really important. And leaning on others when she is struggling, she can reach out to her other therapist friends when she is struggling and hear something that maybe be triggering to her. In your experience, what do you feel is the most important piece of advice for a new clinician such as myself working with victims and survivors of trauma? She says really, really important that you understand yourself before you try to understand others. So learning what you struggle with and addressing your trauma is very important before walking into someone else's life and trying to address that with them. And knowing boundaries and being able to set those with your clients. And advocating for yourself. She says that advocating for yourself is really important. So if you're getting too much, to communicate that. And building a team of people that you feel comfortable working with. What would you recommend to someone looking to become an trauma-informed clinician? She says there's 3 things that she would tell people if they're looking to find a therapist. She says look for experience, so how long they've been doing trauma therapy. Look at their recommendations, so who, like references, who have they worked with, and what do people say about them. And then the 3 times trial, she says you should go see a counselor 3 times before you decide if they are the right match for you or not. What boundaries do you have in your workplace to make sure you can maintain a healthy client-therapist relationship? She says she's very selective about disclosure and when she should share things and when she shouldn't. Only if it's going to benefit the client is when she shares. And then she also talked about how she is there to serve. She does not Sometimes clients will come in because of their like motherly instincts. A lot of her clients are also mothers. They'll come in and be like, oh, how are you today? But she is very clear that she is there for them. She redirects the question saying like, I am good, but the reason why we're here is to talk about how you're doing. In those sorts of situations, she said it's very important to make sure they know that you're serving them and they're not there to serve you. My next question was, how do you balance your work and life, leaving work at work? She said discipline is very important for her. And a lot of it comes down to her faith again, which is like her prayer life. If she starts to think about a client outside of the office or her time with them, she sees that as an opportunity to pray over them and is able to leave that with God. And that's what she believes is the best way for her to do that. What challenges have you faced with insurance and your services? This question was different. Because she has worked with nonprofit and has worked with other associations. The nonprofit we talked a little about earlier, it was a little more challenging because they only had so much insurance that could be covered by counseling. And then now she is a private practice, so she can do that as she pleases, and if she wants to go outside of the insurance boundaries and people may not have the money to pay, she can offer those services within a certain boundaries for her that she's created for herself. I asked next about how she has ended a relationship with clients and what reason she would have to do that. She gave an example of a couple that she was working with and a lot of toxic relationships had like come in, and the couple had been growing at first, but she had sort of gotten pulled into the trauma that they were trying to work through, and so at that point she had to step away, and she asked that they be referred to somebody else. So she worked with them to find a new counselor, and she didn't have support from her agency with that at that point, so she struggled with that a bit because of the lack of support from the agency. She did not know exactly how to handle the situation the best way, so she said that in the future she would look for support when doing that again. And then the last question I asked was, how is trauma counseling different from other counseling? She talked about how trauma is a lot of education, and trauma, she loves to educate people on how trauma impacts your life, and so that a lot of that comes into the counseling portion of it too. Like, a lot of people don't understand the trauma portion of counseling, and to address the trauma with the clients it gives it a different way of learning and letting those people find themselves and look for a new way of life.